Sophia Asan, and I serve as a Senior Technical Officer for the RHSC. We're really glad that you could join us today. Thanks for taking time out of your busy day for this important conversation. A couple of quick housekeeping notes. Please do keep yourselves muted throughout the webinar to prevent background noise. And feel free at any time to enter questions or comments in the chat. They'll be addressed as time allows. And we'll certainly keep them. I'll speak very briefly about this activity from RHSC's strategic perspective, and then hand off to our esteemed moderator. In early 2021, in the early days of the pandemic, actually, the coalition and JSI, or John Snow Incorporated, issued a new roadmap report to share findings and recommendations for when we would be coming out of the pandemic, for building more resilient SRH supply chains for the future. One topic within the report was regional manufacturing and the current lack of manufacturing to scale of SRH products on the continent. RHSC was then pleased to contract with our member US Pharmacopoeia for the activity that they will describe to you today. Looking towards the future and beyond this landscape exercise, which US Pharmacopoeia has led, we at the Coalition Secretariat are excited about the momentum among leaders on the continent to grow the base of pharmaceutical manufacturing and regional regulatory harmonization. We're looking forward to engaging in the coming years with colleagues in Africa and elsewhere to ensure that the interests of SRH products and manufacturers are being taken into account in evolving initiatives. We especially want to express our appreciation to all the other actors who we know are working on the broader manufacturing agenda on the continent. We're actively tracking the progress, and we've initiated and joined dialogues to ensure that SRH supplies are not overlooked. Now, it's my great pleasure to hand this over to our moderator, Beth Yeager. Beth is Senior Director in US Pharmacopoeia's Division of Global Health. She serves as Deputy Director also of the USAID-funded Promoting the Quality of Medicines program. Beth has over 20 years of experience working in both upstream and downstream supply chain management, with a focus on maternal, newborn, and child health commodities. Beth, thank you so much for being with us today as our moderator, and I'm happy to turn this over to your guidance.
Thank you very much, and welcome everyone. As Sophia mentioned, we'll be hearing a presentation from Pere this morning, and then we have an amazing panel who we will be asking, excuse me, for their perspective on manufacturing of maternal health supplies in Africa. So without further ado, allow me to introduce my colleague, Pere Toso. He is a chemist and a public health thought leader, specializing in sustainable pharmaceutical production, advanced manufacturing technologies, and the optimization of drug development and pharmaceutical manufacturing processes, excuse me. He holds specific expertise in process development and integration for production of active pharmaceutical ingredients, and he currently serves as the Director of Pharmaceutical Manufacturing Programs at USP, where he works to expand manufacturing in low and middle income countries to increase equitable access to quality assured medical products. And Pere earned his PhD in medicinal chemistry from Georgetown. So thank you, Pere. Remember, you have 10 to 12 minutes for your presentation, and over to you.
Thank you so much, Beth, and thank you so much, Sophia, for the introduction. And thank you, colleagues online. And as Beth says, I have 10 minutes just to summarize our findings on the landscape analysis that we conducted last year in sub-Saharan Africa, specifically to understand the manufacturing of maternal health products on the continent. As I have been introduced, I work at USP, and USP is a 200 years old organization, and our mission, our work is driven by our mission, and our mission is focused on increasing access to safe and effective medical product to every patient everywhere around the world. Therefore, we aim to ensure that there is equitable access to medical product to everyone. And that drive our work, and that's also drive this work that I'm going to be talking about in the next few minutes. So pretty much what we did was to do a landscape analysis to understand the supply of medical reproductive products on the continent. And the main reason for that is, as Sophia mentioned in her introduction, during COVID, we saw a lot of disruption for the supply of many products, and reproductive health products were hugely impacted. Therefore, it is important to understand what the supply chain looks like on the continent and what is the local resilience for the supply of this product. So we did a landscape analysis for 5 products: histable carbetocin, magnesium sulfate, misoprostol, oxytocin, and tranexamic acid. And our work covered the sub-Saharan part of Africa, but we could not cover every single country. So what we did is to focus on some sample countries, and we decided to choose 8 countries. And if you read the report, you will see some of the criteria that we use to choose those countries. I can mention 2, for instance. One is, number 1, we try to include every country that is ML3, in this case, Tanzania, Nigeria, Ghana, and South Africa. And we also include country per region where we know that they play a significant role in the manufacturing of any product in those regions. And if you look at that, you look at countries like Ethiopia and Kenya in the east, and Zimbabwe as well. And we also include countries where we know that there is at least one company that in those countries that has a product WHO pre-qualified. But why this work matter? It matters because the data show that in 2020, there is close to 300 deaths related to pregnancy or childbirth, and most of those are due to postpartum hemorrhage. And when you look at the data globally, 70% of those happens in sub-Saharan Africa. Therefore, it is really important to understand, are the women in those places receiving the supply they need, and is there a local supply able to meet that demand? So that's why we decided to do this landscape analysis, partnering with the Reproductive Health Coalition. So I will take you through the key findings. The findings are more than this, but I just want to highlight some of the most important ones for the sake of the conversation that we have today. First, one thing that became clear is that there is an over-reliance on foreign export for all of these products. We know that the continent relies on imports for the product, but when it came to the maternal health product, it was very, very significant. Second, the second thing that we realized was that there is only 6 manufacturers from 4 countries, Ethiopia, Kenya, Nigeria, and South Africa, that are currently making this product. And only few of them are making more than one product. And it's only in Nigeria where you have, and Kenya where you have only more than one product being made in those countries. Something that was surprise to us is out of the 5 products that we look at, you don't have multiple manufacturers making those products. You have, in most cases, only one manufacturer making only one product. Only one product that we looked at has more than one manufacturer. And of course, out of the 5 products, one is not made currently on the continent, and that was not a surprise to us. So what does this picture looks like? As a snapshot of the maternal health products manufacturing on the continent, when you take all the 5 products, histable carbetocin is not currently produced on the continent, and that is not a surprise for many reasons, and we detail those in the report. Magnesium sulfate is made by 4 companies. One company in Ethiopia, Kenya, Nigeria, and South Africa, and they all are making the same strength of the products. Oxytocin is made by only one manufacturer in Nigeria. Same with misoprostol, one manufacturer, and tranexamic acid is currently made by only one manufacturer in Kenya. So that's what the picture of the current production looks like. And we also try to understand what is the annual production capacity by each manufacturer or all the manufacturers in the case of magnesium sulfate, for instance. The other key takeaway that I can highlight here is it was good to see, and it was, again, for USP, not a big surprise, that 2 of the 4 manufacturers making magnesium sulfate are currently pursuing WHO pre-qualification, and USP is supporting those companies through funding from USAID under PQM+. The other thing that was really interesting and that affect the manufacturer is the main buyer of these products is just the public sector. It goes from 50% to 100% of the supplies. There are some cases for some product in some countries where all the product 100% are being purchased by the government. In some other cases, you have a distribution between pharmacies and private hospitals, but they are negligible. But interestingly, no NGO or donors is currently purchasing any product from these manufacturers. And based on that, it was clear that most manufacturers produce their product only based on customer order. Is almost 100% to 60%, and few of them have a stock inventory. We also have realized, even though these manufacturers have the product registered in other countries, this particular 4 products currently being produced on the continent, the manufacturers have not registered those products in other countries. And we try to understand why, and those are also highlighted in the report as well. Lastly, one thing that is really interesting is the low utilization rates by the manufacturing factories. It ranges from 10% to 60%, and the median, based on our estimation, is 40%. This highlights the fact that there is a lot of capacity to expand on the continent should the market being there, especially when we know that the manufacturers are producing their product based on the customer order. So we also try to understand what the future looks like. Are there any future plans to expand production on the continent? And we did a sweep in the region. And one thing that we realized is that you can classify the manufacturers that are planning to manufacture this product in 2 categories. One, the ones that are currently producing but want to expand to other products beyond the only one they are currently producing, or the ones that are not currently making any maternal health product but are trying to get into this space. We have identified all of them between those 2 categories, and to our surprise, they are only concentrated in Nigeria, Ghana, and Kenya. Ghana will be the new country where production will be happening when it comes to maternal health products, but there's no other countries where we see other manufacturers trying to get more in this space. And the second thing that was interesting to us is most of these manufacturers have already a really advanced planning, and some of them have gone beyond the product development stage and are registering the product already. And we estimate that most of this production will come in line within 1 year or 2. So what are the recommendations that we have after our study? We have multiple, and I encourage you to read the report, and they are more detailed in there. When it comes to the regulatory agencies, there are a couple that we identify. One is maintaining an up-to-date national regulatory database. In our study, we try to understand what is registered or not, and we saw that there was some discrepancy in what is reported, for instance, and what we know, and also in the nomenclature on the database are not the same when you go from country to country. We believe that will be great if that can be streamlined, especially as the continent is working towards a convergence and harmonization. The manufacturer highlight to us the need for a more streamlined product registration, fee alignments, and approval processes, because they clearly say that it impacts the registration of product beyond the borders. So that will really help manufacturers and also help the access to these products. As we saw that there is a huge interest to expand the manufacturing of this product on the continent, there is a huge need to be strategic so that the manufacturing footprint is more diversified instead of being concentrated in few regions. So there is a big need for coordination between all the stakeholders who are involved. We need to continue to build capacity. This is one thing that manufacturers highlight to us. There needs to be more support to navigate regulatory processes, improve GMP, but also there is a need to absorb new technologies. Manufacturers highlight to us in light of the new technologies that are coming up and new skills required, there is a need to help them to be more capacitated to be able to effectively absorb those technologies and practice them locally. Many manufacturers want to attain WHO pre-qualification, and they have signaled that it will be good if they can have more technical assistance to navigate all the requirements to be able to achieve that. On the procurement side, there is a lot that needs to be done. One thing that became clear to us during our work is, for instance, try to understand what is the demand and the supply on the continent, and it was a big challenge. So trying to prioritize procurement from regional manufacturers and also being able to track the volume will be very helpful and help the manufacturers to have the data they need to be able to make a more informed decision when it comes to their priorities. Market shaping is also important, and there are tools that need to be leveraged there to encourage manufacturers to also continue to expand their production. Because of time, I will stop there, and thank you so much for listening. I look forward to a very insightful discussion. Thank you.
Thank you so much, Pere, and thank you for being mindful of time. And just to remind everyone, if you have questions or comments, please do drop them in the chat. But now I have the pleasure of introducing one of our 3 amazing panelists. And we have the good fortune to have one of the few manufacturers of maternal health products on the continent with us this morning. So I'd like to introduce Osoma Ezoke, and she is the executive director at Emser Pharmaceuticals Limited. It's a leading family-owned transgenerational wellness company. In her 25 years plus as a registered pharmacist, she has spent a significant portion of that time in community practice, cultivating an enduring focus on the healthcare consumer. And her responsibilities are diverse and extend beyond Emsor's legacy in pharmaceutical manufacturing. affording her the opportunity to work in emerging areas of the group's business. And these now include vaccines, medical equipment, and consumables, and most recently, API manufacturing. She also plays an active role in product development, customer relations, and consumer communications. So thank you so much, Usuma, for being with us this morning. And I would like to ask you to share some of your reflections on some of the issues that Pere mentioned in his presentation. What are the challenges MSOR is facing in manufacturing and marketing of its maternal health product, in this case, misoprostol in Nigeria? And what are the barriers that you all are facing to entering international markets? And what changes do you would you like to see in the enabling environment to help, reduce these barriers? So thanks again. Over to you.
All right, thank you so much. It was a lovely, warm welcome. Thank you, Pere, for your excellent presentation. I feel like I can go home now. I think you've covered everything. But to throw in perhaps some unique perspectives from MSOR's journey so far, misoprostol is the only product of the list that's been shared that we manufacture. And I would describe the decision to go into that as, I think one word captures that, very intentional. There are a lot of reasons not to, or at least to be, very cautious in terms of the approach. I think for a lot of manufacturers looking at misoprostol specifically, a big barrier to entry is the exclusivity required. You have to dedicate unique assets to misoprostol manufacture. You can only manufacture other misoprostol containing products, which raises a lot of questions in terms of the return on investment. We might be closer to the 10%, of capacity utilization. I think we'd be closer to that end. So these are very significant considerations. Also, it's a highly technical product. There are issues around degradation and stability of the product. And because it's microdosed in micrograms, that brings in issues of formulation development. I think a tricky issue is content uniformity across, the entire batch. And then even ensuring quality, which is a watchword for all of us, is how do you then have specific investments in lab assets that can properly quantify such low doses. So almost everything that is engaged in the manufacture is specific and dedicated. So that's a very big concern whilst embarking on that. So if we also then cut across and look at APIs, you mentioned MSOR is API manufacturing is a new area for us, but for antimalarials, though, which we selected something a little bit safer, with higher likelihood of use. API access to quality APIs for misoprostol is also a challenge. There tend to be fewer manufacturers and longer lead times, so that also raises issues around planning. The other element is marketing. If you are customer facing, whether that is the direct consumer or a professional customer, your top of mind is quality. What am I bringing to market? Can I stand, with great confidence on this? So the quality conversation is really integral to misoprostol manufacturing. We've seen over time several companies sort of have a little foray and quickly leave because I think they find attaining and ensuring the required quality standards are massively challenging. Very few, WHO pre-qualified, manufacturers. We saw a number of countries. I think South Africa only imports from the US, which would be the originator there. So a fairly tall, competing field if you were to enter. And then coming in from, as a regional manufacturer, coming in from West Africa, the quality conversation is even more keen when you're talking about a technical product. So marketing was virtually impossible if we don't have the quality conversation. So WHO PQ attainment is right at the forefront of what would be required to successfully manufacture and, or rather market this product, on the continent. So all of this, begs the question, why would we even bother? For MSOR, a key focus for us is maternal child commodities, especially things that impact mortality specifically. Pere shared some alarming figures around maternal mortality, and PPH, postpartum hemorrhage, is at the top of that list. So it makes a lot of sense, if we are saying we're committed to this area, that it would show up in terms of the products that we select. We're not naive about the other conversations happening around the off-label use of misoprostol. So that also raises questions of risk, reputational risk. There are organizations and entire countries that will not have any sorts of collaborations or investments, with companies who are engaging here. So the mandate for us is to be well informed, to be at the table, a lot more, learn as much as we can and understand, how one thing, impacts another. Supply chain is also massively important in the region. Storage is important for all pharmaceuticals, but I mentioned degradation issues, so it really becomes a bigger challenge, to whom can you sell? Because when there's an integrity issue with quality, all roads lead back to the manufacturer, even after it's left your locus of control. So in wrapping up, coming onto what are the enablers, and what does it we really need to be doing to successfully execute from MZO's end, but also importantly, invite other manufacturers. Obviously during COVID, we understood the impact of supply chain disruptions. So it's important that we're not, we don't have a key manufacturer risk, which, we already have on the continent. So I think an enabling environment is, first of all, a very collaborative one. A lot of data needs to be shared so that, we are not NGOs. That's another consideration. Manufacturers typically are commercial, and profit-focused entities. Lean manufacturing requires forecasting, access to data, but there are a lot of harmonizing mechanisms. Currently, if we want to, export to other countries within Africa, we typically have to register with each. So there are, collaborative mechanisms for regulatory harmonization. For instance, within WAHO, that requires WHO or at least BE studies, which you might as well get WHO PQ if you're going to embark on that. And offtake agreements are also really important. We need to have an understanding of who's the buyer, how are you buying, what standards are required, who's at the table to support that. And at this point, I really have to call out USP, because irregardless of the product, quality really is quality, and they have, through the PQM plus mechanism across the continent, but especially in Nigeria, their team members they're practically family members. They walk through the plants and everybody knows them, because the intensity of training to bring us up to global best practices is also part of what gives the confidence to embark on what should be a technically difficult product and not be tempted to stay in your lane. So I guess in summary, it's manufacturing any of these commodities is far from pushing the easy button. And in an economic climate where we're importing a lot, there are Forex issues, economies across the world, but also in Africa, it seems serially are very heavily challenged. There has to be a lot at the table to, invite manufacturers not to select something with, more commercial viability. So I hope that's given a little bit of a taster to start. Thank you.
Oh, that's given more than a taste. That was a banquet. Thank you so much for that very comprehensive response. I think, Pere, we need to set up another webinar or something, just with just with you, so we can continue to discuss. That was wonderful. But we have two other magnificent panelists, so I'm afraid we need to move on. Next, we're going to hear from Chimamwe Chamdimba, and she is the head of the African Medicines Regulatory Harmonization Initiative, the AMRH, at the, African Union Development Agency, NIPAD, and she's responsible for the management of the AMRH, leading the technical support to the operationalization of the African Medicines Agency. She's leading policy reforms, linking regulatory system strengthening to procurement in support of local manufacturing of medical products and technologies. And as a health policy specialist, she has spearheaded health policy, regulatory reforms, regional harmonization, and partner coordination. She's contributed to key continental policies, including the AU Model Law on Medical Product Regulation, the Treaty for the Establishment of the African Medicines Agency, and the AU Private Sector Engagement in Health Framework. So Chimemwe, thank you so much for being with us today. Let me see where you are. There you are. I had to move my images along. So could you please tell us how your activities are being planned and implemented in support of advancing regional manufacturing in Africa? What's the status of the work? What are the challenges you're facing? Thank you.
Well, thank you very much. And I think it's good to speak after the manufacturer has spoken. And the report that has come from PRA is quite enlightening. And I think these are the conversations that as a continent we've been having for quite some time. I think we may recall issues around local manufacturing have not just, come to being soon after COVID. They have been there when we started talking about the pharmaceutical manufacturing plan for Africa. But as a continent, we knew, I think Uzoma has said it very well, that quality is quality. It doesn't matter where you're producing the product. It has to be of good quality. It has to be safe. It has to be efficacious. And that's what, from the African Union's perspective, we've been looking at since we started the pharmaceutical manufacturing plan for Africa, that whatever we're doing, it has to be of good quality. That is why I think when you look back to the conversation on local manufacturing, where we started from is to say that can we start with the regulatory environment so that we have an enabling environment for pharmaceutical sector growth? Because we can't talk about improved local manufacturing on the continent, improved access to quality assured medical products on the continent, unless we address our standards and processes for regulating medical products. And I think also, as Zoma has said, currently as is, you still have to navigate quite a different systems in the different member states when it comes to regulating medical products. And we knew that from the from the beginning that this is a challenge, this is a problem. If we want to advance manufacturing on the continent, and even attract others to come and invest on the continent, we need to deal with issues of harmonization. And we need to deal with issues around ensuring that we bring in efficiencies in our regulatory systems. And of course, also issues around being very systematic and predictable when it comes to regulatory standards and processes. And I think as a result, I think what we did then when we started the African Medicines Regulatory Harmonization Initiative, which is led by the African Union Development Agency in collaboration with WHO, we wanted to learn. We wanted to start with baby steps. We started with regional economic communities. Uzoma talked about the ECOWAS process. And I think, of course, she said that there are certain things that still have to be done through WHO. We still recognize a number of aspects of the WHO process. But to us, this has been a learning process. We've had to build trust amongst the regulators so that as they are harmonizing, as they are coming together, to be able to work together, then they have confidence amongst themselves and they've tried something. So they started with, at the regional economic communities, harmonizing registration of generic products, basically just to learn. And for us to take a stepwise approach, while we knew that we'll expand to other regulatory functions as well as other regulated products. And with the lessons that we've learned over the years, it has, of course, not been easy to bring everybody along for us to have a common agenda as a continent. We knew that ultimately what we want is to go beyond the regional economic communities and look at the continent as one, which has led us to the establishment of the African Medicines Agency. And the African Medicines Agency really becomes a game changer. In the sense that we are now starting to look beyond the regs. We are now starting to look at the lessons that we learned in the regional economic communities. When it starts, when it comes to adoption of standards and guidelines and processes at the regional economic community level, and being able to work together through joint assessments and joint GMP inspections of manufacturing sites, and the trust that has been created, using that to then come together as a continent and work as 55. So what we have done so far with the African Medicines Agency, which I think, to me, will be part of the solution to some of the problems that have been indicated here. And the complexity of the products that we are dealing with, it's not just basic generics that we are supposed to be dealing with as a continent. So we started from the word go, when African Medicines Agency the treaty was established, to say, can we then organize ourselves as a continent, build on the technical committees that have already been there, build on the technical expertise that are there to develop continental standards, to develop continental processes, and be able to pull together experts from across the continent. We saw the presentation from Pierre that, you know, we're looking at countries that are beyond the regional blocks. We are now looking at the continent. To the extent that I think so far what we have done is that we have adopted as a continent, continental standards for joint assessments at the continental level and joint GMP inspections. And we are currently piloting them. And I'm hoping that our manufacturers, even on the continent, know, because what we are now doing is that to focus on specific products. AMA is not coming to replace anyone or any regulated authority, but to look at where we have limited capacities, so that AMA can, you know, bridge that complex products that are in limited supply, products where the manufacturer is looking beyond, you know, one market, beyond one region economic community. Those are the products that really the African Medicines Agency is focusing on. And I think looking from here on, we are really advancing as a continent and ensuring that we are responsive to the needs of the industry. That report that has been presented today is quite instrumental in informing the way we moving forward. Beyond the working together and creating trust, we are also looking at other enablers. Pierre talked about issues around information sharing among the regulators. We talked about issues around IT systems that, you know, the regulators need to have in place. So there's quite a lot of things happening on the continent that I'm sure if we are able to work together, we should be able to resolve some of the challenges that we are seeing on the continent. So let me stop there, and I'm sure that with the conversation after now, we'll be able to get deeper into some of these issues. Thank you very much.
Thank you so much. Thank you for your leadership. I think everyone recognizes that the AMA is going to be a real game changer. And I think it's very important what you said about us working together, right? Manufacturers and regulatory agencies, AMA, we're all in this together, and we all have the same goal of ensuring access to quality assured medicines to take care of the populations on the continent. So thanks so much. And now we're going to pass over to our last but never least panelist. So there was a change in schedule for Aremola I can't pronounce names today, sorry you guys, Ospegbesan, pardon. And so we have instead another representative from Unit Aid. With us today is Faith Magwanya. And she is a program officer for regional manufacturing for equitable access at Unit Aid. She has a biomedical engineering background and experience in capacity building and working with countries to support regional production. So we're sad Aremola couldn't join us, but we're super pleased that Faith is with us this morning. So Faith, can you share your reflections with us on the current state of regional manufacturing in Africa from, you know, your perspective where you work, and what work is being supported by Unit Aid to move forward with regional manufacturing? Thanks.
Thank you so much, Beth. Well, firstly, before I start, I'd like to congratulate the organizers for having such a very strong female panel. Normally, you never have women talking about regional manufacturing. So when this happens, you have to applaud it. Then my second thank you goes to USP and the Reproductive Health Suppliers Coalition for inviting us as Unit Aid to speak on such an important topic, and on the excellent work that you have just showcased, showing the capacities of manufacturing of such important commodities. As Unit Aid, our position on regional manufacturing is anchored on the idea that access is not an afterthought. That is to say that we are not just doing regional manufacturing for the sake of regional manufacturing, but ultimately is to enhance equitable access to health products. When you look at Africa, what you realize is that Africa's got one of the highest disease burdens globally, but it only contributes about 4% of the global production, and about 70% of health commodities are actually imported. There are about 600 facilities with a growing population of about 1.2 billion. I like numbers. Why? Because they're very objective and they make us realize the problem that we're dealing with. And when you compare the 600 facilities for 1.2 billion people, and contrast that to 5,000 facilities in China for a similar population size, or 10,000 facilities in India, what this demonstrates really is that regional manufacturing is not just a hot topic. It's not just about import substitution, but it's about self-sufficiency, so that when the next pandemic comes tomorrow, Africa is prepared and Africa is ready. And we as partners are here to support Africa and are very grateful for the leadership that the African Union institutions have demonstrated vis-a-vis the Africa CDC or AUDA NEPAD. So looking into the USP study on maternal health products, it comes at a really good time. And I can't congratulate you enough, actually, as it currently aligns with the work that we are currently doing as UNITAID. We recently concluded a prioritization exercise where we identified 5 priority products for UNITAID to support in regional manufacturing. And in our priority exercise, one of the products that we prioritize and that scored quite highly amongst the different factors that we considered was maternal health, specifically looking at better medicine for postpartum hemorrhage, PPH, and tools to detect preeclampsia. So as UNITAID, we will be leveraging the scoping work that USP has done, and we'll do this by working, by beginning our first project with the European Commission, which is funded by the EU in collaboration with UNFPA, called Safe Birth Africa. And here we'll be working with partners, specifically the regional economic communities, to identify how can we support pooled procurement, for example, of SRHR commodities. How can we start strengthening regional manufacturing of SRHR commodities? And how can we work with other partners in this space? Looking at technical support for manufacturers, we'll be working with SIF in West Africa to see how we can build stronger production capacity for PPH products. And then as UNITAID, we'll be directly supporting generic formulation development on the continent for manufacturers, scaling up on the continent, scale-up work, quality assurance support, specifically focused on regulatory approvals. I think, Uzuma, you touched very well on the challenge of entering markets if you don't have the necessary regulatory approvals. And unfortunately for right now, PQ is the pathway, and we have to get as many African manufacturers going into the pathway and accessing more markets. But not just regulatory, also be looking into how can we do market shaping work? How can we support market expansion? And this will entail supporting product licensing and tech transfers. We will be having the Industry Engagement Forum in Lagos, in Nigeria, from the 7th to the 9th of May. And we will be launching our call for proposals for technical partners to support us on this work, as well as our expression of interest for regional manufacturers who would be interested in receiving support. So it's not just about talking, but really walking the walk and backing this walk with actual feasible support. Thank you very much so much for the kind invitation.
Thank you so much, Faith. That was wonderful. And it is very interesting to see what UNITAID is doing to move this agenda forward. So we all did amazingly well with time management. Thank you, Pere and panelists. So we do have some questions in the chat. Let me see. I think there is one here for you, Pere. Let's get started with that one. There's a question regarding the quality of products manufactured by regional manufacturers. And the question is, are they compliant with quality standards in comparison to SRA WHO approved commodities? So can you speak to that, please?
Can you say that again? Sorry, I missed that. Sorry, can you say that again?
Yes, the question was, are the products that regional manufacturers are manufacturing compliant with quality standards in comparison to SRA WHO PQ approved commodities?
So being comparable or not, you cannot determine that just by looking at that. So you have to go through the regulatory process to be able to, or the application process to be able to know that for sure. One thing that is sure is some of the data that we know, right? Like when you look at on the continent, we have very few companies that currently have the product WHO pre-qualified or SRA approved. Which means that, you know, there are a few things that they need to do to be able to comply to some of those international standards to obtain those approval. We know that some companies are taking that journey and they are improving the GMP and compliance vis-a-vis those requirements. And one thing that we have learned, and this is not just Africa, we also work in Asia as well, is that once we, for instance, USP support companies to be able to go through that journey to have the product WHO pre-qualified or approved by SRA, they are able to translate some of the lessons learned that, from that experience to other products as well to improve on the quality. One thing that is really important for me to highlight here is when you take all the manufacturers that we talk to, and even beyond these products, all of them have their product registered in the country with the regulatory agencies of the country. And some of them, as Uzuma mentioned earlier, are registering their product in the regime of the regional regulatory agencies, meaning that whatever guidelines the national regulatory agency have, they are complying with that. For instance, Nigeria is currently MA3, so EMZO and likes are complying to the quality standard, which is a good thing. So continue to support regulatory agencies everywhere to improve on the current benchmark. If they are ML1, move to ML3, for instance, will be beneficial to patients ultimately, because the quality of the product impact, you know, the patients who are taking them. So it's not to say that the quality is lacking. There are some improvements that are required to be able to comply to the international standard for the likes of WHO or SRI, but some of the companies are taking that steps, and we are supporting them, and we are willing to support more of them. Thank you.
Thank you, Pere. And there are plenty of questions, so we're clearly not going to have time to answer them all, but let's see if I can curate them. There's a series of questions for you, Asuma. Starting with, could you elaborate which additional countries you've attempted to register misoprostol? Where did you succeed and where did you experience challenges? And then also related to misoprostol, there are questions regarding the quality, which you touched on in your response. And so if you wanted to elaborate more on that about the quality concerns and how that relates to the previous question. And then finally, another issue that you touched on in your response was regarding the stigma related to medical abortion and maybe how that relates to challenges to registration or introduction in other countries. So I'm rolling 3 comments and a question into one. Thanks.
Okay, we'll do that quickly. With regard to additional country registration, we decided to go through the WAHO, which is a West African Health Organization portal. So where we stopped, where we haven't finished that registration, is there's a demand for bioequivalent studies. So we made an appeal to see if we could do comparative dissolution, which at times, you know, some bodies will accept, but it's a clear mandate. So it then goes back to priority, where we are already, you know, undertaking the studies for other products, which across the, you know, entire landscape would be more of a priority for us. They are anti-malarials in terms of impact, and then also de-risking projects like that, because we manufacture a wide range of anti-malarials. Our API is an anti-malarial. So the initial PQ candidate and focus on BE would be for anti-malarial. So it's really important if maternal, you know, and reproductive health commodities are going to rise, that there's also a commercial case made. Otherwise, you put investments and then you can't extend. So we're still on that, but also seeking collaborations to deliver on that whilst we do the heavy lifting in the areas where we are already committed. So the quality issue, it's, I think we've spoken about that, but I'll just emphasize again that there is no conversation without that. There aren't two quality standards. And although we have examples from, other continents, say within India, where they have their own, they have IP, and that, as well as, their own GMP standards, etc. I think we also have to see the establishment of certain harmonization mechanisms before we can look at that. So in the short term, I think it makes sense for a manufacturer to, as we say here, tell yourself the truth. This is the door that's open, you pursue it, and then also the benefits reverberate well beyond the products that you select, because you just get better. Your quality systems are enhanced to such a degree you're ready for anything. And then the sticky, why did I get that question? The sticky topic, but it's the elephant in the room, which is abortion. Conversations need to be had. There needs to be very clear understanding around where all the numbers lie. I think people have concerns for various reasons, which I think are clear to most of us. But ultimately, you have to be clear on your position and your why. We want to see maternal mortality drop. We are not in control of the supply chain, so we look at what we ought to do. So at EMSA, we've invested in, an extensive ERP that does end-to-end tracking. I know our regulator, NADAC, is putting a lot of efforts into track and trace. And then there are other regulatory bodies. So for us, might be the Pharmacy Council, who are in charge of what every registered pharmacy does. So everybody needs to come to the table, get training, and then do the right things to ensure compliance with whatever is deemed to be legal, within a country. But unfortunately, the manufacturer is the tip of the iceberg, very visible, and so when there are issues, we're easy to find, but the supply chain, especially across the continent, is less defined. So much more work, needs to go in there. It's certainly something that we are aware of, but it won't stop us in moving forward in the area that we're clear we want to have impact.
Great, thank you so much. So one more question, and this is for you, Chimemwe. There are several questions in the chat asking about accelerated approval pathways, and I think you touched on this in your response. And then there is also mention of a recent MOU between the Medicine Patent Pool and Ferring, including a conditional licensing agreement for heat-stable carbetocin, and how that plays into a vision for regional manufacturing. So again, sort of framing this in terms of what accelerated pathways may already exist, and moving forward, what else we may need to do. And again, you've kind of touched on this in your response already, but if you can elaborate a little bit more. And if I can ask you to be brief so we can do our little lightning round. Thanks.
Okay, in just a minute. Actually, as I said earlier, I'll focus more on the African Medicines Agency perspective, and what we're doing from the African Medicines Agency's perspective when it comes to the approval pathways. And I think I indicated a number of scenarios where the African Medicines Agency or the continental process would be quite important and relevant for the continent. One of which is looking at locally manufactured products, but also during emergencies. I think with what we experienced during COVID, our evaluation of medicinal products technical committee actually is developing guidelines that countries are going to be supported to implement at the country level to ensure that we have pathways that they can use, accelerated pathways that they can use to approve during such times of emergencies. But also, I think the other issue that we have had so far is that the legal frameworks of some of these countries will really limiting for them to be able to go through these pathways. And we're also addressing the issue of the model law on medical products regulation to ensure that it is accommodative and it supports countries to have legal frameworks in place that will enable them to be able to make quick decisions during such emergencies, while at the same time we are providing capacity building at the country level for them to go through, for them to be able to use these pathways that are available to them. for them to use. But I think one other important thing that I wanted to highlight is the issue of reliance. And how we are ensuring that, because if we can do everything that we can at the continental level or at the regional level, but if we don't have mechanisms at the country level for them to be able to rely on decisions that have been made by others, and for them to be able to rely on their fellow regulators in the region with the confidence and the trust that we are building currently, then we have not done much. So we are also looking at building capacities of the countries, the NRIs, in that regard. But I think, as you said, we need a bit more conversations around this. We may need to have a longer conversation for us to get deeper into the discussions. Thank you.
Thank you so much. Okay, so in the 3 minutes we have left, each of our panelists has 30 seconds to tell us what their key takeaways are from this meeting. Maybe something you've learned that you didn't know before, and then maybe one key action item you're going to take away from this meeting. So we'll start with you, Faith. 30 seconds.
There's a lot of work that needs to be done with partners, donors, governments to strengthen the regional capacity production of SRHR commodities. With so many deaths for women, it shouldn't be that case, especially if there's a solution. And as UNITAID, we'll be working with our partners, collaborating with the private sector and other donors to ensure that we support regional manufacturing, not just in Africa, but in other low middle income countries as well. And don't forget to come to the Industry Engagement Forum in Lagos. Thank you.
Thank you so much. Usuma?
Yes, I think my observation is it's the same, the issues are the same. On the continent, the majority of the pharmaceuticals are imported, 70% in Nigeria, much higher, in some other countries. So from the manufacturer's perspective, there's a lot of scope to apply resources to. I think the reasons why you see such a low participation around the commodities we're discussing is that there needs to be much more clarity and collaboration, to deliver on that. But key takeaway from Pere's presentation, there is a cause, but with the right inputs, almost like coming together to design a project or a building, we can get it done. But from the manufacturer's perspective, there's a lot to pull for our attention and resources. So the sooner we have clarity, the sooner we'll be able to have greater impact on the continent. Thank you.
Thanks very much. And last but not least, Chimemwe, parting
Yes.
comments.
Yes, my parting shot is that I think through this conversation that we have had, I've learned quite a lot that there's need for more conversation between the regulator and the industry. I have a feeling that there's some gap in terms of what is happening, even at the continental level, what is available and what we can take advantage of. And also, I think in addition to that, while we do everything that we do, we are not compromising on anything. We are not compromising on quality. We are ensuring that quality standards are maintained while we are responsive to the needs of the continent in both public health concerns as well as the industry growth.
Thank you so much. I couldn't get myself off mute. So thank you very much to our amazing panelists. Thank you, Pere, for your presentation. Safia, do you want to say anything to close us off from the RHSC perspective?
Thank you, Beth. And thank you to our esteemed panelists. Thank you so much to the leadership provided by Beth and Pere and US Pharmacopoeia for this work that RHSC was so pleased to commission. We look forward to continuing our work on all these fronts. And thank you so much for joining us today. Have a great rest of your day.
Thank you.
Thanks, everyone.
Thanks.
Thank you, everyone. Bye-bye.
Bye-bye.